Welcome everybody to PCADV's Training Institute Happy Project Orientation webinar. My name is Michelle Cooper and I'm the Health Education Specialist for the Pennsylvania Coalition Against Domestic Violence. Today we're going to be talking about the Happy Project, and this webinar is designed for any partners who are coming into the project new, or anybody who has been a part of the project that would just like a refresher. Some of the things that we're going to talk about today, we are going to identify the background and goals of the Happy Project. We're also going to apply the universal education model to promote adolescent health. We'll learn how to use the 3 Futures Without Violence safety cards associated with the Happy Project. And then we'll practice making warm referrals to Happy Project partners. This is a very basic webinar, and if there are any aspects of the webinar that you feel you need more education on, my contact information is available at the end, and you can also refer to your medical advocate through the domestic violence program that's associated with the Happy Project for additional training on adolescent relationship abuse, or anything else that you may have questions on. So to get started, we're going to review the Happy Project background and goals. And just in case you don't know, the Happy Project stands for Healthy Adolescence Promoted by Partnerships for Youth. This is a project that was funded by the Pennsylvania Department of Health. It builds on previous community health partnership projects that occurred between domestic violence programs and school nurses. So some of you may be familiar with those, Project Connect and Project Connect 2.0. The addition of family planning sites to this project adds an extra level of community support. So previously, we focused on the same basic universal education model and warm referrals between school nurses and domestic violence programs. And we saw a lot of success with those partnerships in helping adolescents to connect with domestic violence programs that could help them navigate resources for unhealthy relationships. The addition of the family planning sites means that school nurses can also make warm referrals to family planning sites for students who disclose that they have concerns about reproductive health and any other health issues that may be associated with adolescent relationship abuse, specifically those aspects that include sexual or reproductive coercion. Some goals of the Happy Project. Primarily, we want to distinguish between healthy and unhealthy relationships for adolescents. So the materials that are included from Futures Without Violence allow all of the partners for the Happy Project to talk with adolescents, provide resources and materials that will help them distinguish between healthy and unhealthy relationships. The Happy Project also seeks to encourage safe bystander or upstander behavior. We'll talk about that a little bit more when we get into the safety cards, but basically what that means is by providing the same information to every student or adolescent, we're encouraging bystander or upstander behavior, because even if an individual isn't experiencing adolescent relationship abuse, they'll still be receiving that education and will be better able to help other people who might be experiencing those things by passing along the safety cards or information about adolescent relationship abuse. The Happy Project also seeks to educate sexually active adolescents about things like reproductive and sexual coercion and consent. We won't talk a whole lot about those in the webinar today, but we will have opportunities for trainings around that if you request them. So if you need to know more about specifically reproductive sexual coercion, healthy consent, and things like that, then you can get in touch with me or one of the medical advocates to get a little bit more information about that. The Happy Project also wants to create a safe environment to discuss relationships for adolescents. So the idea is that all of the partners within the Happy Project have these trainings, have these materials, and are able to create an environment in which adolescents can discuss their relationship without fear of stigma, without fear of getting in trouble, and to really be able to rely on their community to help get them connected to resources that they need to navigate their relationships in a more effective way. And finally, and arguably most important, we would like to help adolescents connect possible health issues to relationship abuse and help them obtain services. So that key partnership aspect means that, for example, if a school nurse is distributing safety cards and an adolescent identifies through using those safety cards that they may be in an unhealthy relationship, they can also see how that may connect with their reproductive health or general health, and then be directly connected to the partners in the Happy Project, either the domestic violence program, the family planning site, or both if necessary. So you've heard me talk already about the universal education model, so let's talk a little bit about what we mean by that. Before we go into universal education, though, we're just going to do a very quick explanation of what we mean when we say adolescent relationship abuse. And many of you may also be familiar with the term teen dating violence. Much like domestic violence and intimate partner violence, these two terms can be used interchangeably. But for the purposes of the Happy Project, we will define adolescent relationship abuse as patterns of abusive behavior confined within a dating or similarly defined relationship. And one of those safety cards you'll notice is titled hanging out or hooking up. We know that oftentimes adolescents might not use terminology like dating. Sometimes they do, but oftentimes they're not necessarily using that same definition. So what we like to do is to just make sure that when we talk about defining adolescent relationship abuse, we're referring to that kind of dating relationship, similarly defined relationship. So people that are hanging out, people that are hooking up, things like that. These relationship abuse situations are one in which a person exercises power and control over the other. And traditionally, we define adolescent relationship abuse as occurring to individuals between the ages of 10 and 25 years old. But for the purpose of the Happy Project, specifically data collection for the Happy Project, we will be focusing on the age range 10 to 19 years old in order to better reflect the adolescents that will be engaging with school nurse resources through the school districts. When we talk about patterns of abusive behavior, just as a bit of a refresher, these are some of those patterns and abusive behaviors that we see when we talk about relationship abuse. So things like physical abuse, hitting, slapping, punching, or shoving. Mental or emotional abuse, things like gaslighting, blackmail, insults, and isolation tactics. Technological abuse, which can be cyber stalking, monitoring cell phones, sexting, specifically requests for pictures and things like that that another individual may not be comfortable with. Financial abuse, which is monitoring money or not being supportive of another partner's employment. And sexually abusive behavior, harassment, reproductive and sexual coercion, and exploitation. And just to give you an idea of how prevalent this issue is, nearly 1.5 million high school students experience some form of physical abuse, and 1/3 or 32% of female homicides among adolescents between the ages of 11 and 18 are committed by an intimate partner. So we hear a lot of statistics regarding domestic violence. 1 in 5 women will experience some form of abuse in their lifetime. We know that this also happens with male victims of domestic violence. I believe that it's 1 in 6 that will experience some form of physical abuse. So what we're trying to do with the Happy Project is focus in on the fact that these things don't just start in adulthood. And very often we see the same tactics and dynamics begin to develop when people are in that adolescent age group. So this is something that is just as prevalent, if not more so, among our adolescent populations. So when we talk about universal education, this is very important because it allows us to talk to all adolescents about healthy relationships, about those relationship dynamics that might be impactful of their health. Specifically, it gives us an opportunity to talk about reproductive and sexual coercion tactics, what those might look like, and then other kinds of unhealthy behavior as well. Universal education just means education for everyone. So we're not singling anybody out to say that, oh, they look like the type of person that might be experiencing relationship abuse. We're talking to every single adolescent that we interact with. We're providing them with materials. We're screening them for adolescent relationship abuse when appropriate, and helping to have that conversation so that we're providing education for everyone. And what this does is remove stigma through normalization. And we're going to talk a little bit more about some of the cards in more detail. But in general, we can't make any assumptions about who might be more or less likely to experience relationship abuse. And we also can't expect for anybody, but adolescents in particular to the Happy Project, to reach out for help if they're experiencing some kind of issue. There's a lot of stigma that can be associated with relationship abuse. There's also a lot of stigma that can be associated with sexually transmitted infection, relationship abuse that includes things like sexual coercion. And among LGBTQ youth, young men, there's also stigma that comes from disclosing the nature of their relationships. So when we talk to everyone the same way about the same things, it removes that stigma and allows them to decide for themselves if they're experiencing something that they feel they'd like to have some resources and help with. The universal education model also helps us to identify adolescent relationship abuse more frequently. Because we're talking about it more frequently, we're going to be able to identify it more frequently. And finally, this education model allows us to provide education for all on the prevalence of adolescent relationship abuse. So this model provides us an opportunity and gives us the resources to have a good conversation about this. And also the cards that we use in the Happy Project and the universal education model combined with their distribution is a validated form of screening for adolescent relationship abuse and the health impact that it might have. So we know that this is something that's very effective in providing education and providing intervention for adolescent relationship abuse. Now, sometimes there can be some barriers that prevent us from wanting to have those kinds of conversations. Oftentimes, we may feel uncomfortable discussing adolescent relationship abuse with teenagers. There's also a tendency towards frustration when teens don't want to leave the relationship or follow a plan of care. So sometimes we'll spend a lot of time talking with them, we'll provide education, and we'll see them continuing on in a relationship that's already been identified as potentially unhealthy, or we may come up with a plan of care for them to say, oh, why don't you go to the family planning clinic, and they just don't follow through. So we can already feel frustrated before we even start the process of universal education. A lot of times too, we may not know what to do about a positive disclosure of abuse. So if we are doing our universal education with every adolescent every time and they start to talk to us about the fact that they don't feel safe or they have concerns, a big barrier is not really knowing what to do if that happens and feeling unprepared to be able to respond effectively to a disclosure and feeling some pressure and responsibility there. There's also worries about mandated reporting. So if somebody talks to you about a relationship issue and you have to make a mandated report, that can disrupt your rapport. It can make you feel uncomfortable, and it's also time consuming. So we may not want to even start that conversation because of the next issue, which is lack of time. Sometimes these conversations can take a while. So the reason that we like this model specific to the Happy Project is that collaboration really helps to break down some of these barriers. The safety cards help us introduce the topic, frame the conversation, and provide follow-up and hotline information. So this allows us to have that conversation in a really effective way and with confidence, so that our nervousness about talking to adolescents about ARA can be diminished, because we have these safety cards that really help to provide a good framework for that conversation. A safety card plus discussion about options focuses on empowerment and not necessarily a plan. So our frustration about a teen not following through is diminished when we don't really have a plan necessarily. We just give them a lot of resources and then allow them to make decisions that are best for them. And we can offer to facilitate or provide warm referral as needed, which is a lot more open-ended and diminishes a little bit more of that frustration, because it's more of an ongoing conversation than it is necessarily a safety plan of sorts. Warm Referral Network provides an immediate option when disclosures are made. So within the Happy Project, we have the inclusion of school nurses who will be doing the majority of these conversations with their students. And then when a disclosure is made, they will have immediate options for help. They can make a call to the domestic violence program advocate if it's something that a student would like to talk more about with regard to an unhealthy relationship. They will also have a key partner within the family planning clinic that will allow that student to have a conversation about any of the health impacts that they might be concerned about. So it takes the pressure off of that school nurse, for example, to be able to have all of the answers or know exactly what to do. And that warm referral process works throughout the entire partnership. So the domestic violence program can refer to the family planning clinic. The family planning clinic can work in conjunction with the school nurse and the domestic violence program to really provide as many opportunities for resource as possible, so that no one person needs to feel responsible for managing that disclosure alone. One of the things that's really important to do is discuss mandated reporter status before providing education, so that there's no surprises if a disclosure is made. And in other projects similar to Happy, this has always been a very effective way to mitigate that nervousness about what to do if there's a disclosure that requires a mandated report, because you're always talking about your confidentiality limitations first. So if a student or a patient or an individual within the domestic violence program receives the education, looks through the card and says, yeah, I think there's something going on, we can immediately say, okay, I really want to have that conversation. But before we do, I just want to let you know that I am a mandated reporter, and we may have to make a report if you disclose anything to me that rises to the level of child abuse. But if we do that, we can do it together. And you can give them options so that they know ahead of time what to expect. And we know that when someone knows what to expect, then they are allowed to decide for themselves what they do and don't disclose. So that whole thing, once again, is more of a conversation and less of something that is going to take someone by surprise. Finally, the universal education model saves time by streamlining the conversation and providing options for warm referral. So once again, no single person is responsible for managing a response to the disclosure. So within the Happy Project, the universal education model is ideal because it allows us to break down a lot of those barriers that we discussed before and really have a good, valid model for helping have the discussion about adolescent relationship abuse and making the appropriate resources available, including warm referrals to your other key partners. So a few things to consider here, and those of you watching can just sort of think to yourself, or if there's more than one of you in the room, you can kind of have a quick conversation about some of these. But the first question we want to pose is regarding universal education. How often do you think you should discuss adolescent relationship abuse with the adolescents that you come into contact with? The answer to that is, ideally, we want you to provide education with every patient, student, or adolescent that you come into contact with. For those of you that are school nurses, this might look like every time a student comes in for a routine issue, you can just spend a few moments going over the safety cards with them to say, hey, because I know this is becoming so prevalent, thank you for stopping in, and I just wanted to give you these cards and talk a little bit about relationship abuse and the health of your relationship, and let you know that if you have any questions about these cards, I'm here to connect you with any resources possible. Within the health site or family planning clinics, this is something that you can easily incorporate into your regular intakes with patients, especially new patients that are coming in. But really, every time you interact with an adolescent, you can follow up with them. So if an intake includes that universal education and the distribution of safety cards, then the next time that patient comes in, you can follow up and say, hey, I know I gave you some of those cards last time. Did you have a chance to look over them? Do you have any questions? Would you like me to provide you with some more, et cetera, et cetera. So whenever possible, you should be discussing adolescent relationship abuse with the adolescents that you come into contact with through your work. So the next question, where should you discuss adolescent relationship abuse? The answer to that is any place where that conversation can be private. So I realize that for some, this may be a little bit more challenging, especially in the school where people might be coming and going very often, even if your nurse's station is relatively private. But we find that there's always a place where you can have a more private conversation, and especially if there's a room where you can have a closed door conversation, that is ideal. But we want to make sure that, when you're distributing the cards, when you're talking about adolescent relationship abuse, you're doing it in an environment where a student isn't going to feel singled out or stigmatized. So it should always be an opportunity to have a private conversation. And one of the things that we really like to promote through the Happy Project is connection with the domestic violence advocate, because that can be a private conversation between the advocate and the adolescent that, if necessary, can be had, at the domestic violence program or at a private location within the school where the advocate and student can speak, not necessarily in the nurse's station if that tends to be a busier area. But we've found through previous projects that there's always a place, and usually the nurse's station is one of the best places because there is a bit more privacy there as opposed to other places throughout the school. In the family planning clinic, obviously that intake or that appointment provides a good private place to have the conversation and to provide that universal education. And you can make that private conversation a regular part of your interaction with every student and every patient that you have. And it's something as simple as saying, we take a few minutes in every appointment to just have a private conversation about your health. That way, if there's somebody that's accompanying the student or the patient to their appointment, it's a rule that you're setting and letting them know that it's consistent for everyone. So once again, nobody feels like they're being singled out. The next question is, when should you discuss adolescent relationship abuse? So there's a couple of options here, and we've kind of talked about this already, but conversations with new patients, for those of you who are watching from family planning clinics, students coming in for routine issues like we discussed before, and then for anybody that's engaging in community outreach, tabling events, health fairs, assemblies, Anytime you have an opportunity to interact with adolescents and provide them with the materials, those are really good opportunities to have a conversation about adolescent relationship abuse, especially distributing the safety cards and offering to have a conversation or answer any questions. And then we like to ask, who should I educate about adolescent relationship abuse? And I think you probably can anticipate the answer to this one, but of course it's every adolescent can benefit from education about ARA. So any opportunity that you have to have these discussions with adolescents are going to be very beneficial. And once again, we go back to that avoiding stigma. When we have this conversation with everyone, we're giving everyone the opportunity to identify and to have access to the resources that they need. Okay, so now we're going to talk a little bit more about the actual safety cards that you'll be using as part of the HAPPY project. And these cards are provided by Futures Without Violence. They help to discuss healthy and unhealthy relationships. They allow us to provide that bystander education. So even if an individual isn't experiencing an unhealthy relationship themselves, they can still have those materials that they can hand out to friends, family members, anybody else that may be experiencing some of those unhealthy behaviors, and it will help them to identify them a little bit more easily. The cards help to raise awareness of the issue of adolescent relationship abuse and how relationship abuse in general can impact somebody's health. And it also helps to provide information about referral services. And that's a big part of what the HAPPY project is focused on, are those warm referrals between partners. But not only that, the cards also include other national resources for adolescents, and we'll talk more about that as we get into the cards themselves. The most important thing to remember is that when you're using the cards, you're using them to normalize the conversation. You're using them to empower adolescents to make decisions that are going to work best for them. And you're helping them to connect to the resources that are available to them. And specifically with the HAPPY project, that's going to be your HAPPY project partners. So the first card that we're going to talk about is the one I talked about before, which is hanging out or hooking up. This card focuses in on general information about healthy and unhealthy relationships. An example is, I talk to everyone who comes in about this because we know how prevalent the issue is. So 1 in 5 girls, 1 in 7.5 boys, and 1 in 2.3.33 youth who identify as LGBTQ+ report having experienced some form of abuse in their relationship. Now, I don't expect you to have those statistics memorized, but this is just for you to understand the prevalence of the issue so that when you distribute the card, a good way to say it is just, I talk to everybody that I see because I know that this issue is so prevalent and so many people experience it. The hanging out or hooking up card is really important because it's a non-judgmental resource that helps the individual identify how the person they're seeing or hooking up with treats them. So it focuses in on some of the different behaviors that we know are red flags for unhealthy relationships. And it provides the adolescent with a lot of different examples of unhealthy behavior that they might be able to identify both in their partner and sometimes in themselves. You can use it for yourself or you can share it with a friend. This is often how we might introduce the safety card to an adolescent. The focus of the hanging out or hooking up card is on respect. It also has some information about social media. So is their partner or the person that they're hooking up with using social media as a way to control them? Focuses on texting. We talked a little bit before about the technological abuse aspect of ARA. It also focuses on sex and coercive behavior and red flags for abusive dynamics. So this card is a really valuable resource for any adolescent, because it helps them really identify some of those red flag behaviors. And then it provides resources like hotline numbers, websites they can visit, and even a text option if they need help. We'll also want to use the distribution of the hanging out or hooking up card as a time to mention the domestic violence program and the local resources that might be available. Next, we have the Caring Relationships and Healthy You card. And this card is specific to LGBTQ+ youth. Just to offer some statistics about LGBTQ+ youth, and these statistics were provided by the Urban Institute. Based on a study that they did, 42.8% of LGB youth, so transgender youth were not included in this particular survey, reported being physically abused by dating partners, as opposed to 29% of the heterosexual youth that were surveyed. In addition, sexual coercion for LGB respondents was 23.2% compared to 12.3% for the heterosexual youth that were surveyed. And then transgender youth that were surveyed reported 88.9% physical dating violence. So you can see that this is an issue that impacts LGBTQ+ youth, and it certainly impacts them just as much as or more so than heterosexual youth in some cases. Now, this is just one study, but I like these statistics because they really help us understand that LGBTQ+ youth are experiencing these issues, and oftentimes the dynamics are specific to some of the issues that LGBTQ youth experience, including fear of being outed. So the Caring Relationships and Healthy You card is more inclusive. It focuses on whether a partner supports or respects the individual, and it includes language that focuses on the fact that abuse occurs in all kinds of relationships, and everyone deserves to be in a relationship that is supportive. The focus of the Caring Relationships Healthy You card is on unhealthy dynamics, just like the other card is, but it also focuses on LGBTQ+ specific issues like dead naming, which would be using the previous name that they may have used but do not identify with anymore. And dead naming is a form of disrespect that can be included in an unhealthy relationship. It also focuses on things like hormone and medication restriction for individuals that are going through hormone therapy, threats to out that individual by their partner, and it also focuses on safety planning and harm reduction for LGBTQ youth. The resources for this card are similar to the other two. It includes hotline numbers, websites, and text options for help. And when distributing this card, if an individual chooses to come out to you and identify that they are in an unhealthy relationship, I highly recommend being familiar with some of the LGBTQ resources that are available to you locally. And if you have questions about that, that's something that I can help you figure out if you're not familiar with those resources. One thing to remember with regard to LGBTQ youth is that they may not come out to you, and that is okay. We're not handing these cards out to students or adolescents that we have identified as LGBTQ. We're handing them out to everyone. And that once again helps to remove that stigma so that a youth doesn't have to come out to you or anybody in order to receive information that's beneficial to them. So this card is distributed along with the other two without any expectation of disclosure. It's just another resource for individuals to have if they choose to use it, and once again promotes upstander behavior, because even if they're not experiencing this issue or don't identify as LGBTQ+, they may have friends or family members that do, and they might be able to pass this information along to them. Finally, we have the Did You Know Your Relationship Affects Your Health card. This card is really specific to some of the health impacts of relationship abuse. Some statistics to keep in mind: 1/4 of adolescent females said their abusive male partners were actively trying to get them pregnant. That's what we refer to as reproductive coercion. Girls who are victims of dating violence are 4 to 6 times more likely than non-abused girls to become pregnant because of the combination of abuse tactics that include physical violence, threats of physical violence, and reproductive and sexual coercion. 40% of pregnant women who have been exposed to abuse report that their pregnancy was unintended, compared to just 8% of non-abused women. So we know that relationships really do impact the health of an individual and their reproductive health in particular, in addition to other long-term health impacts. So the Did You Know Your Relationship Affects Your Health card is reproductive health centered. It focuses on things like healthy and unhealthy behavior, birth control, family planning, physical health, and then safety planning and healthcare options. It asks questions like, does my partner support my using birth control? Or has my partner ever threatened me because I didn't agree to get pregnant? These are some things that an individual may not even realize are unhealthy, but this card will help them identify this and will help them come up with some options that will help to keep them safe. And they can discuss with family planning clinic providers, things like birth control that might be a little bit more effective or able to be hidden from a partner, things like that. Once again, the resource on this card is the same: hotline numbers, websites, and text options for help. And the distribution of all 3 of those cards together through the Happy Project allows each adolescent to really have a holistic understanding of all of the different aspects of adolescent relationship abuse and how it might be impacting them, both their reproductive health and other forms of well-being. Each one of these will also assist you in understanding how to make a warm referral and to which partner you might want to make that referral to. These safety card interventions are validated as effective methods of intervention for adolescent relationship abuse. Among women 16 to 29 years who received the card and a verbal explanation of the card, so that universal education along with the safety card, there was a 71% reduction in the odds of pregnancy pressure and coercion compared to a control group. So we know that once an individual has a better understanding of those unhealthy relationship dynamics, it's a lot easier for them to mitigate that pregnancy pressure and coercion. They're also 60% more likely to end a relationship because it felt unsafe or unhealthy. So these are methods that we know are very effective in identifying relationship abuse and helping to provide intervention and support for somebody that's experiencing it. So finally, we're going to talk a bit about disclosure and warm referral, and this is a big part of the Happy Project. So you've become familiar with the universal education model. You understand the safety cards that are associated with the Happy Project and what they include. And now we're going to talk about what happens when you may receive a disclosure or an adolescent asks for more information about some of the partners in the Happy Project. So first I want to give you an example of something that you might say when somebody discloses birth control sabotage. This is just an example, but one way that you might respond is to simply say, well, what you've told me makes me worried about your health and safety. Sometimes when a partner's trying to have a child when you don't want one, they might also try to control or hurt you in other ways. And that opens up a conversation about other unhealthy relationship dynamics that may indicate that they need a referral to a domestic violence partner or a family planning clinic partner. So the way that you can respond to disclosures, what can you do if a student or a patient discloses that they're experiencing unhealthy or abusive behavior from a partner? Well, the first and most important thing is to just validate their experience. Whenever somebody chooses to disclose to you, it's very important that you let them know that you believe them, that it's not their fault, and that you're able to help get them connected to whatever resources they feel comfortable with. The next thing to do is to review the information on the safety card that might be helpful. So you have 3 different safety cards, and depending on what they disclose, you might be able to use one of those cards to say, what you're telling me is indicative of an unhealthy relationship dynamic. What you're disclosing to me sounds a little bit like reproductive coercion, and that makes me feel really worried about your safety. You can then ask about their safety concerns. Do you feel safe with your partner? Has your partner ever done anything else that made you feel unsafe or like they were going to do something to hurt you? And then depending on how they respond to that, you can make a warm referral directly to your family planning clinic partner, domestic violence hotline, or advocate partner as needed. And that as needed is really important because while we want to track the warm referrals through the Happy Project, we also don't want to make anybody do something they're not comfortable with doing. So the warm referral is really, just something that you can provide to someone when they disclose that they're not feeling healthy or if they have questions. And the warm referral is just very simply a referral that shows that you feel comfortable with the person or agency that you're referring to. It doesn't mean that that individual has to engage in services. It doesn't mean that they have to necessarily show up for their appointment, although we like to try and track and see if they make it there. But most importantly, it's just making that referral and letting them know that that option is available and that you have a good relationship with the person or agency that you're referring to. Finally, it's really important to provide some follow-up. So if you make a warm referral or if somebody talks to you about something, next time you see them, when it's appropriate and private, you can follow up and say, hey, did you have a chance to read that card that I gave you? Or were you able to talk to the domestic violence advocate? They may not feel comfortable sharing that with you, but the follow-up allows you to just provide an opportunity for that individual to talk with you more if they need to let you know that they lost the card that you had written the hotline number down on, or any other number of challenges that they may have experienced that you can help them work through. If nothing else, it just allows that adolescent to feel like you're really invested in them. And that means that they're more likely to continue the conversation and talking with you. So even if they didn't ask for or require a warm referral when they disclosed or when they started talking to you, the more you follow up with them, the more likely it is that they're going to trust the recommendation that you make and follow through with resources as needed. When we talk about warm referral, that's just a referral that feels really genuine and supportive. It shows a connection to the person or organization you're referring to. It increases the comfort level of the patient or the student with whom you're making that referral. And it really encourages an individual to use available resources. So it's the difference between kind of just giving them a card and telling them to read it versus giving them a card, explaining what the card is, and then saying, my colleague Karen works for the domestic violence program. I've been working with her for a really long time, and she's really been able to help a lot of the students that I talk to. I'd love to be able to connect you if you want, or I can set up some time for her to meet with you, or I can just give you her information, and if you want to give her a call at any time, you can. That kind of referral really allows that individual to feel like they have a choice, that they're not in trouble, and they can do whatever they feel comfortable with doing versus just handing them a card and kind of giving them all of the responsibility to decide, what they want to do. Warm referrals also give the individual an opportunity to ask you some questions. If you're making a referral to a family planning clinic, they might have a lot of questions. What kind of neighborhood is it? Are they going to be nice to me? What am I going to have to do? Is my partner going to find out? And that allows you to talk them through that experience so that they're better able to make a decision that they feel really comfortable with. The warm referral process is very simple. If a disclosure is made or somebody says they have questions about family planning or they'd like to talk to an advocate, you just make a direct connection to that partner agency. You can say something like, I have a phone in the next room if you'd like to help me call, or would you like me to step out so you can use the room privately to make a phone call? Any way that you can directly connect that individual to the partner agency. and then follow up as needed, checking up to see if they were able to make an appointment, if they were able to get in touch, remembering that they don't necessarily have to give you that information, but the follow-up is just a really important part of the warm referral process because it shows that individual that you really care about them and that you're invested in their health and safety. So really quickly, before we get to the end of the webinar, I just want to run through a scenario with all of you, and this kind of ties everything together that we've been talking about. So I'll allow you to read on your own, but I'm just going to read through this scenario quickly and then we'll talk about it. A 19-year-old patient comes into the family planning clinic for an exam and a pregnancy test. The practitioner introduces the "Did you know your relationship affects your health" card and goes through the questions with her. As they discuss her relationship, she opens up more about the control her boyfriend has taken over her, including hiding her birth control pills and accusing her of cheating when she asks him to wear a condom. After the test results reveal that she is pregnant, she begins to cry and discloses that she did not intend for this to happen. She is scared because now that she's pregnant, she knows he will not allow her to terminate the pregnancy. The practitioner asks if she would like to talk to a domestic violence advocate about options for support. She says yes, although she is worried he will find out since he's in the waiting room. The practitioner calls the advocate using the phone in the treatment room and tells the patient she can use the room as long as she needs to, then gives her privacy for a confidential discussion. So that scenario allows us to see the benefits of the universal education and the warm referral models. The safety card helped to identify the unhealthy relationship dynamics. The warm referral allowed the patient to have private access to a hotline where they could talk to the domestic violence advocate. And the relationship between the family planning clinic and the domestic violence program offers ongoing safety planning and support for that individual. So you can see where this Happy Project model that includes universal education and warm referral really benefits the adolescent because it creates a community of care and a lot of supportive partnership between all of the agencies and partners invested in making sure that adolescents are able to get the resources that they need. So at this time, we're going to wrap up the webinar, and if you have any questions, I encourage you to contact me. My email address, as listed, is mcooper@pcadv.org. You can email me anytime with any questions that you might have, and you can also reach me at 717-545-6400. My extension is 119. And I just want to take this moment to welcome you all to the Happy Project. I hope that this has been a helpful orientation, and I encourage you to reach out to me and your other community leadership team partners for any other questions that you have, ongoing training needs, or anything that you need to support you in your time as a Happy Project partner. Thank you so much for taking the time to view this webinar, and I'll look forward to working with you in the future.